Good evening, everyone, and thank you all for joining us for the session. And it is going to be a life-saving session today. And we have Dr. Neema Bhat. She is a hematologist and a pediatric oncologist, Therrapie Clinic, Bangalore. And there's 1 in 3 patients, cancer patients, are being diagnosed very lately, and this is going to kill even more patients. So, Dr. Neema Bhat is here, and we'll be discussing about what is blood cancer, types of blood cancers, what are the warning signs, and what are the treatment options, what are the advancement, and how can it be diagnosed at the early stage, and what hope can it give. So hi Dr. Ma'am, and we I just welcome you for the session. And can you please just go through like what is blood cancer, and anything about it.
Hi. Thank you, Dr. Vandana. Really happy to be here on the session today, and thank you to all the people who have joined the session. I hope I'm audible. Yes, so as Dr. Vandana said, I'm Dr. Neema Bhat. I'm a senior consultant hematologist. I completed my undergrad training in India and then went to the US for residency and fellowship and completed my fellowship over there. I've been working in India for the last 8 years, and I have treated patients with different types of blood disorders, blood cancers, including doing complicated procedures called bone marrow transplantations for them. I've done more than 300 bone marrow transplantations, including various types of bone marrow transplants for different indications with different backgrounds. I work at Therrapie Oncology Clinic in Bangalore as well as Apollo Hospitals. So, as Dr. Vandana said, yes, nearly 1 in 3 blood cancer patients get diagnosed a little too late. And one of the most common reasons for that is the late recognition or failure to recognize symptoms, so to say. So it's very normal for anybody, in their daily walks of life to say, "Hey, I'm tired today. I just had a low-grade fever, but it just seems like it keeps on coming back. I am feeling a little more tired than my usual. I've been brushing my teeth, and almost every day I've been noticing a little bit of bleeding from the gums. I have these random bruises that are occurring, repeatedly. I have this swelling in the side of my neck that has been there for like 2 weeks now, but has not really disappeared. It's not really painful, but I don't really think much of it to get it checked out." So if you interact with enough people on a daily basis, on a regular basis, there are a lot of friends who, as friends, sometimes we just share symptoms casually, and sometimes probably a little too casually to pay closer attention to it because we don't think it can be anything big. However, the way to catch blood cancers and the reason we are having this conversation today is precisely that if you have any of these symptoms that I'm going to elaborate a little more in detail later, do not ignore it or try to ignore do not ignore it or try to get it checked out or examined or assessed by a doctor, the appropriate doctor, at the earliest, because although blood cancer is a deadly major disease, the symptoms usually start off small. So when we ignore the small symptoms, that's when the small problems tend to become bigger, and that's when the disease becomes later stage or higher risk and becomes more and more difficult to treat. So today in this webinar, we are mostly going to be talking, as Dr. Vandana described, we are going to be talking about what are the warning signs, what are the most common blood tests that we are going to be conducting as part of evaluation of patient for possible blood cancer. How do we determine with higher end tests what types of blood cancer it is, and what are the treatment options, and what is the cure?
Uh, yes, ma'am. People usually think like cancer is just one disease, but can you please just explain us like what are the types of blood cancers and how they differ from each other?
Yes. So this is something that most people don't know. Most people know about blood cancer just by watching it on TV or TV serials or movies, and there is a lot of uh, catastrophization. There's a lot of morbidity and extreme ways of mortality that's attached to blood cancer. So just to break it down, blood is made in the bone marrow factory. So bone marrow is nothing but it's an organ, just like we have heart, kidney, liver. Bone marrow is a factory which produces blood cells, right? So this factory makes three types of blood cells: red blood cells, white blood cells, and platelets. So red blood cells are the ones that carry oxygen, and they help deliver oxygen to different tissues in the body. White blood cells are the ones that form part of our immune system, and they help us fight off infections. They're the ones that cause fevers. They're ones that cause abscesses, or the pus-filled swellings. So those are the ones that are called white blood cells. They're part of our army or immune system. And platelets are the cells that sort of function as a repair crew, and they are the ones that, if they are low, then it can lead to bruising, it can lead to bluish patches, it can cause bleeding. So those are the three main types of blood cells. Now, what happens is, when any cancer happens, it means the normal functioning or the normal workings of that particular organ is affected. So similar to that, blood cancer is usually something that affects the factory or the different parts of the blood system. Apart from bone marrow factory, which forms part of the blood system, we also have small, nodes or small swellings, we call it. They're called lymph nodes. They are like forts that are located in the neck, in the axilla, in the groin, and they help sort of contain the infection to a certain part, and they're very rich in these white blood cells. So that's another part of the blood system. In addition to bone marrow, we also have the blood system. If anything goes wrong, or there is cancer in this bone marrow or in this lymph nodes, then all these are called blood cancer. So cancer arising in any of these is called blood cancer. And cancer is what? It's when normal cells are not there, or normal cells are taken over by abnormally, extremely fast dividing, abnormal functioning cells or cancer cells. And what are the consequences of blood cancer? As I said, these normal cells, which are red blood cells, white blood cells, and platelets, are significantly reduced in number because of blood cancer, because of the abnormal cancer cells increasingly multiplying. So it causes low hemoglobin or anemia. It can cause low WBC count or very high WBC counts, because those are the cancerous cells. And it usually causes low platelet counts as well. Consequence of low platelets is bleeding. Consequence of high WBC count is usually having recurrent fevers, or these large lymph nodes that we can feel, or swellings in either the neck or the axilla. So just to give some basic stats, about 1.3 lakh patients are diagnosed with a new blood cancer in India per year. So the source is ICMR, and about more than a lakh patients are diagnosed with blood cancer all over India in a year. One more point, as we were mentioning, so we will talk about what are the three different types of leukemia. As I said, most often people can't name them, and you can't really be aware of something if you don't even know that it exists. So leukemia, which is referring to increased WBC counts. So there are different types of leukemia again. So it is mainly leukemia, lymphoma, and myeloma. So these are the three main types of blood cancer that are seen and need diagnosis and treatment.
Yeah, before going to the next question, I just want to remind the audience. Meanwhile, you can just type out your queries in the comment section, and yeah, it will be addressed at the end. And ma'am, it was really interesting to know all this. And what are the main things like patients has to be concerned about? Like, what are the warning signs so they can just go and seek out medical advice?
Yeah, so as we just spoke about the three main types of leukemia, the warning signs is something that we'll talk about, because I think that is something we should really focus upon. This is a general awareness video for normal people who are joining, and then we can definitely talk about what are the different types of cancer. So these leukemia, lymphoma, myeloma, and we can go a little bit more in depth. So warning signs that we should know about, and I would really prompt the audience to write it down, because these are symptoms that you really don't want to ignore. um, Yeah, so we all normally see a little bit of bruising. We all normally see a few red dots called petechiae. All of us have fevers time to time. We all have slightly swollen lymph nodes. So all these are very normal symptoms or normal things that happen to us on a day-to-day basis. However, if you are facing significant tiredness, repeatedly having significant tiredness, every day feels like it's extremely tiresome for you to, get out of bed, go to work. Walking a short distance makes you tired. You're getting recurrent fevers, so repeatedly getting fevers multiple times a day that goes on for days together, or sometimes a couple weeks or more than that. If you are noticing bleeding very often, so bleeding from the gums when you're brushing your teeth, bleeding from the nose, unexplained bruises. So it's normal to get bruises in the legs and back, but which are pressure areas, which are usually exposed to, trauma. But when you notice bruises, say on the chest or on the thighs or on the buttocks, these are areas which are usually not exposed to trauma. That is a red sign. Or that's a red flag. So those are some things that should not be ignored. When you notice that you have lack of appetite without any reason, so you're doing your daily activities, you are but you're still not feeling hungry, and I mean extreme drop in your appetite, not at all feeling hungry, not even able to eat say one or two decent meals a day. When you feel like you're losing weight and that weight is unexplained, you're not trying to lose weight, you're still able to eat, a good few meals, but despite that you're losing weight, and it's extreme weight loss. It is not like I lost 1 kg in a month, or hey, I lost like half a kilo in 2-3 weeks. No, what we're talking about is 4 to 5 kg weight loss in 2 to 3 weeks period of time. Quite a drastic weight loss where you actually feel, okay, my clothes are really fitting me loose, my pants are not really staying on, and I can really feel the way I look because I've lost so much weight. So these are all really, really concerning signs. And if you see at least two or more of these symptoms and they last for long enough, so you have fever and fatigue that last for more than 2 weeks, you have lymph nodes that have been sort of there in multiple parts of the body or in your neck, and it's not really responding to basic antibiotics your physician might have prescribed, or it's not really going away, staying there for more than 2 weeks. You have body pains, you have bone pains, you have bruises, all of these complaints that are not really going away for 2 weeks, plus your fevers that have not resolved, then these are symptoms you should absolutely not ignore. So the key message would be, if you have 2+ signs of whatever I have mentioned, persisting for at least 2 weeks or more, don't hesitate to go get at least an expert opinion and get simple testing done. What are the tests we do to diagnose blood cancer? It sounds a little funny almost, but for any hematologist, for any blood specialist, the first test we start off with is what is called a complete blood count. So notice that I'm telling you it is not hemoglobin, it's not WBC count, it's not platelets, it is complete blood count, which means we look at all three main parameters of the blood, or the blood as an organ. In addition to that, we also look at a lot of other parameters that form a part of the complete blood count, including any cancer cells that may be circulating in the blood. We also look at typical morphological symptoms, as in what the red cells look like, what the WBC cells look like, what the platelets look like. So we see all of that also. And sorry, once again. And in addition to this, there's another small test called peripheral smear, where we take the blood, put it on a glass slide, put it under a microscope, and pay specific attention to, okay, are there any abnormal cells? What is really wrong with the cells, that we are seeing? And we are able to pick up blood cancer a lot of times just with those small tests. Of course, all blood cancers cannot be diagnosed with this, but a complete blood count would, although it costs you only about 200 or 500, most centers are able to do a complete blood count in about 500 rupees. So a simple small prick with a small blood sample that costs you only about 500 rupees or even lesser is able to clinch the diagnosis for most of us. So it can be lymphoma, it can be myeloma, it can be leukemia. It at least gives a clue. For leukemia, it is almost a diagnostic test. It really tells us, okay, this patient has leukemia. But for myeloma and lymphoma, it usually gives a clue. So for myeloma patients, usually the hemoglobin is down. If it is, picked up in the later stages, then platelet counts can be down and WBC counts can also be down. For a lymphoma patient, usually the platelets are down or the hemoglobin is down. So there is some of the other clue that is there on the patient's blood count. And usually takes it's very quick. I mean, complete blood count in bigger centers take not more than 2 to 3 hours. Peripheral smear also not more than 2 to 3 hours. If you go to a smaller center or a smaller lab, also you tend to get complete blood count reports within a day. If something is abnormal, the pathologist may take one extra day and say, I need to cross check the reports, and maybe I may take a little more time, but most often you'll have the reports within one day. Um, yeah. So, Dr. Vandana, back to you.
Yes, ma'am. There is one hope what people have is like advancements in cancer treatment. Could you just help us know about the cancer treatments advancement and what patients can expect? Like, what is the outcome of the treatment process, ma'am? What is available in India? What patients can expect from doctors like you, ma'am?
Yeah. So, before we go into more depth about what are the treatments available, I think we should address what are the three main types of blood cancer. As I said, I mentioned leukemia, myeloma, lymphoma. So let's go a little bit more in detail. Leukemia is specifically the cancer that's associated with white blood cells, right? So when, one second, sorry. Am I audible? Hello, Dr. Vandana?
Yes, ma'am. You're audible. You can continue, ma'am. Yeah.
Okay, sorry. Yeah, so leukemia is nothing but a cancer that involves the bone marrow or the blood forming factory or blood forming tissue. So it is where the normal blood cells, which is red blood cells and platelets, and the normal white blood cells are completely crowded out of the bone marrow because of the cancer cells multiplying. There are mainly two types of leukemia. It can be acute leukemia or chronic leukemia. Acute means it's very serious, it can escalate very fast and presents with very serious symptoms, and also the treatment is very aggressive and requires hospitalization most often, requires chemotherapy, and overall outcome is not so good. The second type is chronic variety, and chronic leukemias are usually seen in the elderly population, usually not seen in very young people, and usually takes time to develop, and the symptoms, although they may be there, they may be very mild and they may not present, and don't really manifest very fast. As in, the treatment is also not very aggressive. A lot of patients with chronic, especially a type of leukemia called CLL or chronic lymphocytic leukemia, don't really require any treatment. We just notice the changes in their blood counts and monitor their symptoms and only start treating them if it is required, usually which is after a period of few months. So, to break it down further, acute leukemias are again two types: ALL and AML, acute lymphoblastic leukemia and acute myeloid leukemia. If I go into the depths, you'll become a hematologist soon. So I can't really go into more depth without, I can just say that both of them are quite serious. They are very acute. It causes severe anemia, which is drop in your hemoglobin counts. It also causes severe drop in your platelet counts. Acute leukemias are leukemias where symptoms should absolutely not be ignored, not for more than 2 to 3 days, because it can actually kill a person if you ignore the symptoms for too long. Second, the chronic leukemias are either CML or CLL. Again, chronic myeloid leukemia, which is fairly easily diagnosed by doing a blood test and a bone marrow study. And it is a disease which is a testimony of how treatment can change over years. So previously, for example, for CML, we used to do bone marrow transplantation. So the highest procedure that there is to cure blood cancers. But now you will not believe me if I tell you that CML can be cured with a tablet, like with one tablet that has to be taken for 4 years, 4 or 5 years, yes, but it is very much controllable and curable with just a tablet. And CLL, as I mentioned, is a disease of the elderly. It happens in patients who are at least 55, 60 years and older. And they usually present with high WBC counts on the CBC, sometimes enlarged lymph nodes, maybe slightly large spleen, but no other major symptoms or complaints. And depending on which staging they fall into, they can just be observed, or very minimal treatment, just like CML, maybe a tablet is required and nothing more than that. Um, Depending on what type these cancers are, of course, the diagnosis and the diagnostic tests we use vary. And of course, the treatment that is offered for all these different types of leukemia is different. As I said, for ALLs, which are more common, ALL and AML, which are more common in the younger population, ALLs are more common in children and also in young adults, and AMLs is in the teenage population or slightly older children. And young adults, all the way up until 45, 50 years of age. For these acute leukemias, we have to ensure that they are diagnosed at the right time. They undergo a bone marrow aspiration biopsy. We quantify the exact amount of leukemia. Um, However, they also require admission and they need high dose chemotherapy. Depending on how they respond to this chemotherapy and what risk stratification, if they're high risk or low risk, we decide that based on a lot of testing and genetic testing also. So, based on that, we decide what risk and then we decide what is the treatment. So AMLs and ALLs patients, they usually require a combination of immunotherapy and chemotherapy, and eventually they also require bone marrow transplantation depending on how they respond. Next, coming to different type of blood cancer, which is lymphoma. It is mostly cancer of the lymphatic system. As I explained, if you have small nodes and swellings in your neck or the axilla or an organ we call spleen that we have in the abdomen, that is all part of lymphatic system, and cancer that affects that system is called lymphoma. It again has two varieties: Hodgkin's lymphoma, which usually occurs in young adults between the age of 15 to 40 years of age, but the cure rates are extremely high, upwards of 90%, and with minimal chemotherapy and immunotherapy. Versus non-Hodgkin's lymphoma, which is usually seen in slightly older people, usually above the age of 55, 60. There are, of course, some types that also happen in younger individuals, including teenagers. There are 60 plus different types of non-Hodgkin's lymphoma, and identifying the exact type of non-Hodgkin's lymphoma is extremely important because the treatment varies and the drug type varies, the immunotherapy agent that we use varies, and the outcomes, of course, vary depending on what treatment is given. Last but not the least is myeloma. So myeloma involves cells called plasma cells, and it is like a multi-system disease which involves the bones, kidneys, immune system, usually seen in patients above the age of 60. And good for myeloma and lymphoma, we have something called targeted therapy. So for lymphoma, we have a lot of new agents. Rituximab is one of the oldest agents. We have something called brentuximab. We have nivolumab. We have pembrolizumab. So there's a lot of new agents that are available for lymphoma patients. Similarly for myeloma, we have a drug called daratumumab. We have teclistamab. So previously, myeloma was also a dreaded disease because we had only about 4 or 5 medications, first line, second line, third line, post which we didn't really have much to offer. However, now with the targetable therapy or immunotherapy that's available, we are able to give good responses and good outcomes, even able to come down in the amount of chemotherapy given because these medications can be delivered even in elderly, frail patients with very less side effects. So, as I said, all blood cancers, there are different varieties of blood cancers and they all behave differently, they all present differently, they're all diagnosed differently, but it finally boils down to who is the one who's diagnosing it, and are they really up to date, or are they really aware of all the latest treatment modalities available at this point, not only in our country but also outside. So we are able to offer the best for the patient, so the outcomes are good, but at the same time the side effects are at a minimum as much as possible.
Thank you, ma'am. That was very informative. And can we just go to the comment section, ma'am, and answer a few questions? Okay. I mean, there is one person asking about multiple myeloma and has
Mm-hmm.
neutropenia and swelling in legs and foot.
Hmm.
Okay. And
I can answer that. So, multiple myeloma patients, it depends on what treatment they are receiving. If they are receiving, significant amount of chemotherapy and that has caused the drop in counts, then it can, I mean, you're talking of that he has neutropenia and swelling in the leg. So most probably this patient has an infection in the leg in addition to multiple myeloma. And of course, the multiple myeloma has caused
Please,
the patient. I think I'll ignore the comments because I'm getting distracted. Dr.
yes,
Vandana, you can ask me the questions and I can
yes,
answer
ma'am.
them. Yeah,
Yeah,
that's
yes,
better.
ma'am. Yeah.
Yeah, so neutropenia is a complication of the chemotherapy and medicines that is given for myeloma patients, especially if the bone marrow is significantly affected, with the plasma cells or myeloma. Key thing is to first treat the infection. If possible, discuss with your hematologist, halt or change the medications that are being delivered for myeloma right now for the time being. The priority will be treating the infection, which is the leg swelling, and after that proceeding. If the leg swelling is not because of infection, if there is severe anemia or the kidney functions are affected, the creatinine is elevated, then first thing would be to take care of the kidney functions, make sure that the medicines are being given appropriately, because the treatment for myeloma varies depending on how good is the cardiac function of the patient, how good is the kidney functions of the patient, and then depending on that we titrate the drugs. So the appropriate medicines have to be given so that those organs are not further affected or damaged. At the same time, myeloma can be treated.
Yes, ma'am. And there is one question. Is polycythemia vera is a blood cancer? So, could you please address this,
Yes.
ma'am?
Yes. So polycythemia vera is one of the chronic blood cancers. If you, it is a type of, you can call it almost like a type of leukemia, but it is not an acute leukemia. It is not a condition which requires you to get admitted and, undergo significant chemotherapy. It's a chronic condition, develops slowly over time. The polycythemia vera refers to when the hemoglobin is high, WBC count is high, and platelet count is high. Usually comes with a gene mutation called JAK2 mutation. There are a couple of other mutations also that can be positive in polycythemia vera. If they are younger patients and if they're positive for a certain genetic mutation, they can be treated with just a tablet called ruxolitinib or Jakavi. And if there are changes of early acute blood cancer, that is also common in these polycythemia vera patients, it can transform into acute cancers. Then it has to be addressed at the time with the right chemotherapy and probably even require a bone marrow transplantation. That's not true for everybody, however. Depending on how high their counts are and what is their bone marrow reports and what how significant the marrow reports are, the hematologist will take a call.
Oh, thank you, ma'am. And is this medicine is should be continued for lifetime? So, this is a question from one
Which
patient. So,
medicine?
I mean, I'm not. They're not mentioned it. I mean, maybe the all most of the medicines you have mentioned regarding this, maybe CML for CML also.
So yes, for CML, the theory previously was to try and continue medications for lifetime, but now we have uh, data, especially from the West. In India, we are still gathering the data about treatment-free period. So after we treat for at least about 5 years, we monitor these genetic markers, repeatedly over time. And if we feel that there is a satisfactory, not just reduction, resolution. So if this particular gene called BCR-ABL, if it is completely gone, even to the deeper levels, then we are able to give breaks. But patient has to stay on continuous follow-up because there is always a risk of this coming back. And on follow-up, you have to make sure to check blood counts and the BCR-ABL levels at regular intervals as advised by your doctor. Without follow-up, it is bound to come back. And when it comes back, it usually comes back with a vengeance. And it has to be picked up at the earliest and treated.
Okay, I think Mr. Vijay, I think your question was answered. And there is one more question, ma'am. Like, okay, yeah, he has some lung issue, and even he falls sick often every 2 to 3 months. And he's on lenalidomide 15 mg, cyclophosphamide 400 mg, and Dexat 20 mg combination. He wants to know if there is any cause for it.
Yeah, so sounds like it's the patient with multiple myeloma, but lenalidomide 15 mg is a good dose. So it's a combination of chemotherapy, steroid, and lenalidomide. If the counts are absolutely normal, one other thing that helps sometimes is giving IVIG infusion. So if the patients have low immunoglobulin levels, which helps fight off infections, that can be given as an infusion to help them fight. The other thing some doctors do is before we start chemotherapy, if we feel that the patient is very frail, we try to immunize them. We try to give them their vaccines, build up their immunity, and then start the treatment. So these are the two ways that recurrent infections can be avoided. The other thing is when patient is older and they're on myeloma treatment, if the counts are not so great, we advise try to avoid going out, meeting too many people, try and avoid crowds, don't go to too many temples or malls, eat very fresh and healthy hot food that's cooked at home, and not food from the street, not food from the restaurant, and avoid infections as much as possible by contact.
Okay, thank you, ma'am. And there is one question. They wanted to know if there is any reason behind this. Is been taking medicine for hypertension, and the problem is like joint pain and headache, teeth pressure, or something. And what could be the reason for this? Maybe he wants to know the reason. Like, is it because of some
Could
cancer?
this be that's a very non-specific question. See, somebody who is older and with other comorbidities and taking medications, first thing I would look at most commonly is vitamin D. So if the vitamin D levels are low, then taking vitamin D will help. It will help improve the joint and leg pains. But there is no detail as to how old the patient is over here. Headache, teeth pressure. So these are very non-specific symptoms. I would say you need to see a physician, and if not done, at least get a basic set of blood tests done, which is at least a complete blood count, peripheral smear, check if you're a diabetic, make sure that your kidney functions and liver functions are all okay. And of course, check vitamin B12 and vitamin D because those are most common deficiencies that can explain some of your symptoms and it can be treated easily.
Okay, ma'am. There are more questions coming up. Like, I just show it up. I was diagnosed with AML and bone marrow transplant is done, and after 6 months, chimerism report has come down to 90%, which was 100% previously, but now it's stable now. So, is this a concern as of now? Like,
So, chimerism, yes, we always try to start off post transplant. We try to start off as close to 100 as possible, but 100 is not like the magical number. As long as the leukemia is not coming back and the chimerism is staying at least above 80-85% with normal blood counts and there being no blasts in the periphery, it is not much of a concern. The way post transplant period works for leukemia patients is we take off their immunosuppression a little fast so that the graft versus so whichever transplant graft is there that can fight the leukemia and keep it under control. So I would follow up with your hematologist and make sure to check chimerisms regularly. But in addition to that, also check CBC and blast percentage and make sure that the leukemia is not coming back. But just the chimerism dropping is not a concern that the leukemia is back.
yeah, thank you, ma'am. And there is Chaitra. I think the concern is low hemoglobin. I'll just show it, ma'am. Yeah.
Hemoglobin is level is 7 and there's no symptoms of thyroid. What can we do to improve the blood? First, check your, especially if it's a female patient, check your iron profile and ferritin. Also, check your vitamin B12 and folic acid level. If all of those are appropriate or normal within normal levels and still you have anemia, I would suggest you undergo a little detailed testing by a hematologist, including peripheral smear, hemoglobin electrophoresis, because yes, most often the cause is iron or B12 and folate deficiency, especially in women. But when all these things have been normalized and still anemia is persisting, then there are more detailed reasons, and that has to be tackled with specific tests. You find out what is the reason and then treat. Only then it'll improve. I would strongly suggest you consult a hematologist, so they'll be able to sort you out because 7 is quite low. It's not borderline; it's quite low, and if you let it go, it will drop even further.
I think we have covered most of the questions, ma'am. Um, so if there is any more questions, you can just type it down.
So I think one last thing I did not really touch upon much is what are the main treatment options that are available for blood cancers. So in general, chemotherapy, targeted therapy, like I mentioned, that tablet for CML, which brings around survival for long periods of time, 15, 20 years. Immunotherapy, like using medications that are able to activate the immune system, like CAR T cell therapy, bone marrow transplantation, which is where we replace the entire bone marrow or the factory or that makes blood for patients, and of course radiation, which is used for some lymphomas and also some leukemias prior to transplant. The the positive thing is a lot of leukemias are quite treatable. Also, although they come with quite strong medications and chemotherapy, a lot of leukemias and lymphomas are treatable. Myelomas are controllable, almost curable, but we don't consider that myelomas can be completely cured. If you look at the cost, because that's one important point that we should touch upon, the cost overview, if it depends on what is the type of chemotherapy, what is the type of cancer we are looking at. If you're looking at, say, myeloma, then we are talking about approximately 40 to 50,000 per cycle. Again, it depends on what is the medication, what is the dosing, what is the complication that's expected for that patient. So all of these is something that we take into account. Of course, keeping the patient's outcome as the primary focus, because we can't just focus on the money. We have to make sure that the primary focus or the main focus is on the patient's well-being and their eventual final, good outcome.
Yeah, I think we have covered all the questions, ma'am. Thank you for joining us to evening and giving us like so much of knowledge so people can just find out like at the earlier stages and they can get it medical advice and get it treated as soon as possible. And thank you everyone for spending this evening with us. So I guess this will be helpful for all of you, and you can also share it with your family members and your friends, so it will also be helpful. And if they are facing and going through this issues, or if they find out these symptoms, and this can help them, so they can just go and seek advice with doctors like Dr. Neema Bhat. Yeah.
Dr. Vandana, before we wrap up, one last key message is
Yes,
blood
ma'am.
cancer is it's not a death sentence. So it has really been hyped up in movies, especially कि आज मुझे blood cancer हो गया तो अभी ज़्यादा दिन नहीं बचे. It's very as I said, morbidized. So it's not a death sentence. It always helps to contact the right doctor, seek the right tests, and seek the right treatment, so that you are the one who can change things and say, okay, this is not a death sentence. There is life beyond blood cancer, as long as you consult the right person. There is definitely hope even for patients with blood cancer. Just make sure to not ignore your symptoms, get the right test done, and see the right specialists, so that things can, get better. With
Yes,
that,
ma'am.
yeah, I think we can wrap up the session. Thank you so much, Dr. Vandana, for coordinating the session. Thank you all for joining. I hope you have a lovely weekend and have a good night. Thank you.
Thank you, ma'am. Thank you so much for sharing your knowledge and so generously. Thank you so much, ma'am.
Thank
Yeah.
you.
Thank you.